Congreso is a nonprofit organization that helps Hispanic and Latino communities figure out ways on how they can provide better life-changing services. Professional workers like Judith and Julia can tell you more about what Congreso does and how they help the community.
So my name is Judith Emmons, and I'm the Director of Primary Care here at Congreso.
Julia Rivera, and I'm the Director of External Affairs at Congreso.
So we are a federally qualified health center. We were established in 2011. We basically came to be because Congreso took a look at the continuum of services that we were providing to our clients and realized that it kind of stopped at healthcare. So we partnered with Public Health Management Corporation to open a federally qualified health center in this community. We started off very humbly and small on our second floor of our main building. I think we had 4 exam rooms. And we expanded in 2015, so we merged with a private practice that was already existing here with Dr. Eduardo Munilla. And it was really a great relationship to be able to serve his patients as well and really build that relationship with him and also, the trust with the community members who had already been seeing him, who now are seeing a lot of our different providers that are here. How don't we? we do a lot. Do you want to take that one?
Sure. So, really, any of our services in some way impact the Latino community. We're located in this location for a reason, and that is to specifically serve the Latino community where they are today. Even though that is changing somewhat, that's really why we are located where we are. So we have 3 different divisions of services: education and workforce services, health promotion and wellness, which is what the FQHC falls under, the health center, and then family and housing services. So we really cover the gamut when it comes to social services, anything from, like I said, housing, education, workforce development, and health. And all of that we try to do in a way that is culturally appreciative and client-centered, and a lot of that, a lot of our clients are Hispanic and Latino, so a lot of our staff are bilingual. It's definitely not a requirement. We serve folks of all different backgrounds at Congreso, but there's definitely a large population of Latinos that specifically feel comfortable coming to Congreso because they know they can get bilingual services.
Right. They feel comfortable speaking at home, so they can get by in the community and maybe at work speaking English. But when they come to the doctor, they're able to speak in Spanish and feel really comfortable and not feel like they missed anything or they misunderstood something and didn't know how to ask, or maybe the word didn't quite translate well into English. They don't really have to have any of those worries. They know that they can come here and have their health care in their language. Okay. So sometimes it can be challenging if we have a patient who comes in who, like I said, might speak a language like Arabic or Vietnamese, or even there's some specific dialects, and different languages that are really kind of not common in this area of Philadelphia. And so when we're calling the language line to provide translation services, it might take a little bit longer for them to actually find a rep who speaks, this specific dialect from, this, country in this little province where, it's a little bit different. So that can be challenging. Because it can be really challenging, especially, like I said, with finding a specialty care provider. Where do I go? How do I find that person? How do I make the appointment? Will they speak my language? What do I do once I get there? And so we have about 20% of our population is uninsured and uninsurable. Okay. So when they come to us with needs that we can't necessarily work with here in a primary care setting, we're referring them out to our partners in the community who we know can support them. We try and touch every aspect of the patient's life and make sure that they just feel really comfortable with their health care, that they have all the resources that they need, that we're making sure that it's a warm handoff when they're going to either social service referrals or specialty care providers, and making sure that they feel that they can always call us and ask questions or come back and talk to their provider. We have a walk-in policy, an open door policy, so they can come in, they can meet with our nurse care managers who can really, if they still have questions about maybe a chronic condition that they have, and they thought that they got it cleared up after their meeting with the doctor, and then they kind of realize they go home and they're like, wait, when do I take my insulin, and what line is it supposed to be on, and where am I supposed to do this, and all of those things. So they can come back and get one-on-one education sessions with our nurses.
Okay.
So that can be really helpful. I think we always just try and look at everything in a solutions focused lens and say, you know, what can we do to make this a good experience for the patient? How can we, you know, make sure that it's productive for us, and, you know, ensuring efficiencies and things like that. So I guess it depends on the specific situation, but we always try and make sure that, you know, and if we do, you know, have an issue that comes up, we always try and make sure that next time we do it better. You know, we're able to kind of see that coming again, and make sure that we fix it before it happens again.